Embracing Change, Understanding Acceptance and Commitment Therapy, ACT. In mental health and psychological well-being. Various therapeutic approaches have emerged to help individuals overcome challenges and lead fulfilling lives. One such practical and innovative approach is acceptance and commitment therapy, ACT. Developed in the 1980s by psychologists Stephen C. Hayes, Kelly G. Wilson, and Kirk D. Strosahl. ACT is a form of psychotherapy that combines acceptance and mindfulness strategies with commitment and behavior change techniques. Its unique perspective on coping with distress and fostering personal growth has gained significant popularity. This video delves into the principles and practices of ACT, exploring its benefits and potential applications. The core principles of ACT. Acceptance and commitment therapy is rooted in 6 core principles, which collectively aim to help individuals achieve psychological flexibility. 1. Acceptance. ACT encourages individuals to embrace their thoughts and feelings without attempting to avoid or suppress them. By acknowledging these emotions, individuals can better understand their internal experiences and develop healthier relationships with their minds. 2. Cognitive diffusion. This principle focuses on separating oneself from unhelpful thoughts, reducing their impact on behavior. Individuals can gain greater control over their reactions by learning to see thoughts as mere mental events and not necessarily reflective of reality. 3. Present moment awareness, mindfulness. Practicing mindfulness enables individuals to be fully present in the current moment without judgment. This heightened awareness helps individuals become more attuned to their thoughts and emotions, fostering a sense of clarity and purpose. 4. Self as context. ACT challenges the idea of a fixed self-concept by encouraging individuals to view themselves as an ever-evolving process. This flexibility allows room for personal growth and transformation. 5. Values clarification. Identifying and clarifying one's core values provides direction and purpose in life. ACT emphasizes aligning actions with these values to foster a meaningful existence. 6. Committed action. Taking concrete steps toward living by one's values is essential in ACT. By committing to behavioral changes, individuals can create a more fulfilling life. Techniques used in ACT. ACT employs various evidence-based techniques to address psychological distress and enhance psychological flexibility. 1. Metaphors and storytelling. Therapists often use metaphors and stories to illustrate complex concepts, making them more relatable and accessible for clients. 2. Thought diffusion exercises. Through playful exercises, clients are encouraged to distance themselves from their thoughts, reducing their power over behavior. 3. Mindfulness meditation. Mindfulness helps individuals observe their thoughts and feelings without attachment or judgment, promoting a calmer and more centered state of mind. 4. Values assessment. Therapists work with clients to identify their core values, paving the way for meaningful goal setting and actions. 5. Behavioral activation. This involves setting small, achievable goals that align with clients' values, fostering a sense of accomplishment and motivation for further progress. Applications of ACT. Acceptance and commitment therapy has demonstrated effectiveness in treating various psychological issues, including 1. Anxiety disorders. ACT helps individuals face their anxieties and develop coping mechanisms, reducing avoidance behaviors and enhancing overall well-being. 2. Depression. By promoting acceptance and mindfulness, ACT helps individuals navigate negative emotions and build resilience against depressive episodes. 3. Chronic pain management. ACT can aid individuals in accepting pain and adopting strategies to improve their quality of life, despite ongoing physical challenges. 4. Substance abuse. ACT can be integrated into addiction treatment, assisting individuals in overcoming cravings and making positive lifestyle changes. 5. Stress reduction. ACT equips individuals with tools to manage stress more effectively and build emotional resilience. Acceptance and commitment therapy, ACT, is a powerful and versatile therapeutic approach that empowers individuals to embrace life's challenges and lead more meaningful lives. By fostering acceptance, mindfulness, and commitment to personal values, ACT helps individuals develop psychological flexibility, ultimately leading to improved mental health and well-being. As the field of psychotherapy continues to evolve, ACT's unique principles and techniques offer a valuable contribution to the array of therapeutic options available to those seeking personal growth and transformation. In acceptance and commitment therapy, ACT, metaphors and stories are often used to illustrate complex psychological concepts and help clients better understand and apply the therapy principles. Here are some specific examples of metaphors and stories commonly used in ACT. 1. The passengers on the bus metaphor. In this metaphor, the mind is likened to a bus, and individuals are the drivers. The passengers represent thoughts and emotions. We cannot control which passengers, thoughts and feelings, get on the bus, but we can choose how we respond to them. Instead of trying to kick sure passengers off the bus or avoid them altogether, ACT encourages individuals to acknowledge the presence of all passengers, both positive and negative thoughts. Focus on driving the bus towards their values, and not let the passengers dictate their destination. 2. The leaves on a stream metaphor. Clients may be asked to imagine floating on a stream in mindfulness exercises. The leaves represent thoughts, and the stream symbolizes the flow of consciousness. The goal is not to stop the leaves, ideas, from appearing, but to observe them as they come and go without getting caught up or carried away by them. This metaphor emphasizes the practice of non-judgmental awareness of thoughts and feelings. 3. The tug-of-war metaphor illustrates the struggle between avoiding distressing thoughts and facing them head-on. It likens avoiding thoughts to a tug-of-war with an imaginary monster. The more one pulls away from the beast, the stronger and scarier it becomes. However, when one turns to face the beast, accepts the distressing thought, it often transforms into something less threatening. This metaphor highlights that avoiding uncomfortable thoughts can amplify their impact while acceptance reduces their power. 4. The muddy water metaphor. Imagine a glass of muddy water. When agitated or stirred, the water becomes murkier. However, if you allow the water to settle, the mud sinks to the bottom and the water becomes clear again. Similarly, our minds can become clouded with thoughts and emotions. The metaphor illustrates that if we give ourselves time and space to settle, our thoughts and feelings will become more precise, and we can make wiser decisions. If you found value so far in the video, please like and subscribe to support this channel, it will be appreciated. 5. The choice point story highlights the concept of choice and the power of choosing how to respond to life's challenges. It tells of a wise elder who teaches that there is a choice between stimulus and response. We can choose how we react to a situation at that moment. The story encourages individuals to embrace this space and make choices that align with their values and long-term well-being. 6. The Chinese finger trap metaphor compares the struggle of escaping a Chinese finger trap, a woven tube that tightens around your fingers when you pull, to the battle with emotional discomfort. The more you resist or struggle against uncomfortable emotions, the tighter they grip you. However, by relaxing and accepting the pain, you can find a way to free yourself from its hold. These metaphors and stories are powerful tools in ACT, helping clients grasp complex psychological concepts in relatable and memorable ways. They encourage individuals to adopt a more flexible and accepting mindset, empowering them to confront challenges and move toward a more values-driven and fulfilling life. Real-life examples of individuals benefiting from acceptance and commitment therapy, ACT. 1. Overcoming social anxiety. Sarah, a 30-year-old woman, struggled with debilitating social anxiety. That made attending social gatherings or engaging in small talk challenging. Through ACT, she learned to accept her anxious thoughts and feelings without judgment. She realized that avoiding social situations reinforced her anxiety. With the help of her therapist, Sarah identified her core values of connection and friendship. Armed with this clarity, she gradually exposed herself to social situations, using mindfulness techniques to stay present and observe her anxious thoughts. Over time, her confidence grew, and she built meaningful relationships and participated in social events that she had previously avoided. 2. Coping with chronic pain. Mark, a 50-year-old man, had been living with chronic back pain for many years, leading to frustration and depression. ACT helped him acknowledge his pain and change his relationship with it. Rather than viewing pain as an enemy to fight against, he learned to be mindful of his physical sensations without resisting them. By setting meaningful goals based on his values, such as spending quality time with his family and pursuing his hobbies, Mark found motivation to engage in activities despite the pain. He discovered that while he couldn't eliminate the pain, he could lead a fulfilling life alongside it, reducing its impact on his overall well-being. 3. Recovering from substance abuse. James, a 25-year-old struggling with alcohol addiction, sought help through ACT. He realized that his drinking was a way to avoid his emotions and problems. In therapy, James learned cognitive diffusion techniques to separate himself from the urge to drink and accept his difficult emotions without self-judgment. With the support of his therapist, he identified his core values, including self-care and personal growth. This newfound clarity allowed him to commit to sobriety and use healthier coping strategies. Over time, James found that by accepting his emotions and staying committed to his values, he could maintain a life free from alcohol addiction. 4. Managing stress and work-life balance. Lisa, a 35-year-old professional, was overwhelmed with work-related stress and struggling to maintain a work-life balance. ACT helped her recognize her perfectionistic tendencies and the constant pressure she put on herself to succeed. Lisa learned to take breaks and be present with her family through mindfulness exercises without feeling guilty about work. Lisa worked with her therapist to clarify her values. She realized she valued time with her loved ones, personal growth, and creativity. This awareness motivated her to set boundaries at work and prioritize her personal life, resulting in decreased stress and improved overall well-being. 5. Embracing self-compassion. John, a 22-year-old university student, suffered from low self-esteem and harsh self-criticism, leading to feelings of unworthiness. ACT introduced him to self-compassion and self as context, helping him recognize that his thoughts and feelings did not define him. John practiced mindfulness to observe his self-critical thoughts without getting entangled in them. He also engaged in values-based actions, which included volunteering to help others and being kind to himself. Over time, he developed a more compassionate and accepting attitude towards himself, positively impacting his mental well-being and academic performance. Acceptance and commitment therapy, ACT, has touched the lives of numerous individuals, helping them overcome various challenges and achieve personal growth. We can see how one can apply ACT's principles and techniques in practical situations through real-life examples like Sarah, Mark, James, Lisa, and John. These individuals could transform their lives positively by accepting thoughts and emotions, practicing mindfulness, clarifying values, and taking committed action. The power of ACT lies in its capacity to empower individuals to confront distress, embrace change, and lead lives guided by their deepest values. These stories demonstrate the potential of ACT to create lasting and meaningful transformations in the lives of those who embrace its principles. Effectiveness of acceptance and commitment therapy, ACT, in treating psychological issues. A review of evidence. Acceptance and commitment therapy, ACT, has garnered substantial empirical support as a practical approach for treating various psychological issues. Numerous studies have demonstrated the therapy's potential impact on an individual's mental health, offering evidence of its effectiveness in improving multiple conditions. Below are some key findings from research studies that highlight ACT's efficacy in treating different psychological challenges. 1. Anxiety disorders. A meta-analysis conducted by Atijak et al. 2015 examined the effectiveness of ACT in treating anxiety disorders. The analysis included 39 studies and concluded that ACT significantly improved in reducing anxiety symptoms. The therapies focus on accepting anxiety-related thoughts and feelings, while committing to valued actions contributed to its positive outcomes. 2. Depression. A randomized controlled trial by Zettel and Raines, 1989, investigated the effects of ACT on depression. Participants receiving ACT showed significantly reduced depressive symptoms compared to a control group. Moreover, a meta-analysis by Loppalainen et al. 2014 found that ACT interventions were associated with moderate to large effect sizes in reducing symptoms of depression. 3. Chronic pain management. In a study by Viehoff et al. 2011, individuals with chronic pain participated in an ACT intervention. The results indicated that ACT effectively improved physical functioning, reduced pain-related anxiety, and enhanced overall quality of life in these individuals. 4. Substance abuse. 2 meta-analyses conducted by Lee et al. 2015, and Tapper et al. 2019 examined the efficacy of ACT in treating substance abuse. Both analyses reported that ACT interventions were associated with significant reductions in substance use and related problems. ACT's focus on mindfulness, acceptance of urges, and values-based actions contributed to its effectiveness in supporting recovery. 5. Stress reduction. A randomized controlled trial by Bond and Bunce, 2000, explored the effects of ACT on stress reduction in a workplace setting. Participants who received ACT reported decreased stress levels and increased psychological flexibility, indicating the therapy's potential to manage stress-related challenges. 6. Eating disorders. A study by Lillis et al. 2009 investigated the impact of ACT in treating individuals with binge eating disorders. The results showed that ACT significantly reduced binge eating episodes and improved psychological well-being in the participants. These studies provide compelling evidence of ACT's effectiveness in treating various psychological issues, ranging from anxiety and depression to chronic pain and substance abuse. The therapy's emphasis on acceptance, mindfulness, and values-based actions appears crucial in promoting psychological flexibility and fostering positive changes in clients' lives. The evidence supporting acceptance and commitment therapy's efficacy in treating psychological issues is substantial and diverse. Numerous studies and meta-analyses have consistently demonstrated ACT's positive impact on reducing symptoms and improving well-being across various mental health challenges. Whether individuals are struggling with anxiety, depression, chronic pain, substance abuse, stress, or eating disorders, ACT offers a promising therapeutic approach that empowers individuals to confront distress, accept their emotions, and commit to meaningful actions aligned with their values. The empirical support for ACT's effectiveness makes it a valuable and evidence-based option for individuals seeking lasting and meaningful transformations in their mental health and overall quality of life. If you enjoy this video, please give it a thumbs up, like and subscribe to our channel for more content. Don't forget to click the bell notification to get notified anytime we post a new video. Thanks for watching, see you in the next video.